Hi, my name is Aaron Bodette, and I am a licensed life accident and health insurance agent in the state of New York and 7 or 8 other states. And I wanted to just have a brief discussion with you on Medicaid, Medicare, and a question that I get quite frequently, or the scenario that I get quite frequently. Many times I meet somebody who is just aging into Medicare, meaning they're just about to or have just turned 65, or they're in that wheelhouse somewhere. And quite often when I meet somebody in that, position, I ask them some hard questions about, what insurance they have now. And many times they have Medicaid, or they don't know they have Medicaid, or they love their plan because it's really, favorable and attractive. A lot of people tell me I have zero premium. I don't pay any premium. When I go to the doctor, I don't have any copay. If I go to the hospital, I don't have any copay. If I have testing or CAT scans or MRIs, lab work, emergency room, some people have dental, some people have vision. It's all zero copays. And usually, they obtain that through the New York State of Health website. And that tells me that's a key indicator that they probably have Medicaid, which has been an interesting program since the ACA came about. But there are a few things that they don't know. And what they don't know is that when you turn 65, the standards for obtaining Medicaid alongside of Medicare change. And I'm going to share a few screens just to, show you what I'm talking about, because sometimes this is an eye opener for people. They're like, wow, I don't want to go on Medicare if I'm not going to keep Medicaid, because, sensibly, they may experience a premium, but more importantly, they may lose Medicaid status. And I hate to be the bearer of bad news, but I do announce this to people many times, and then I try to find out, if they fit in anywhere. So I want to show you this. I just, did a quick Google search on this, and I wanted to show you this screen right here, which are the income thresholds. This was a simple Google search, Medicaid income guidelines in New York. And this was kind of cool, this little pop-up here. Okay, so it shows two columns. One is for Medicaid levels for single people and couples without children, and age 65 plus. This assumes you have no children. So if your annual income is 17,609 or less, and you're single in New York and you're not 65, you're going to get Medicaid. That's the zero premium plan that I was just talking about. No premiums, no copays, what have you. If your income is over this, you'll likely have a very small premium if it's close to this. If it's way over this, then you probably won't get any subsidy at all helping pay for the premiums, because here in middle New York, 100 miles north of Manhattan, the premiums for a plan that has a low or a zero deductible with reasonable copays, but they're reasonable, between $1,100 and $1,200 a month. And in Manhattan, they're $2,000 a month or north of that. So this is really interesting. If there's two people in the household, you're not 65, no children, it's 23,792. It goes up close to 30,000 if there's three in the household. If you add kids, this can go up depending upon how many kids in the household. There's a calculator you can use on the New York State of Health website. It's nystateofhealth.ny.gov. So here's a scenario that I was talking about. I meet somebody and they're on Medicaid. They're 64 years old. They're about to age into Medicare. And they start getting mail from Social Security, or they get, from CMS, the Center for Medicaid Services. And they're going to roll over to Medicare, which carries a standard premium of $144.60 in 2020, going up to $148.50 in 2021. If you have Medicaid now, you automatically continue on that path when you go on to Medicare, really regardless of what your income is. However, what happens soon after, because the income changes drastically from 17,609 to 10,500, this is $875 a month. So because of this change, what happens is the Department of Social Services will send you a questionnaire. Sometimes it comes 3 or 4 months after you age in, you turn 65 years old. Sometimes it happens quicker. I have seen people who got it right away. So you never know when. And that questionnaire is going to be pretty telling because they're going to ask a lot of questions. There's one piece here that I left out, and I want to make sure I'm clear on that. On this chart, you'll notice, I know I'm moving my mouse a lot, they don't talk about assets, and that's something that is of interest because there's no asset test when you're not 65. Meaning, what does that mean? That means, they let you obviously have a house and a car and, basic necessities, your furniture and what have you. But I mean, if you have any substantial assets, you own other real estate or land or stocks or bonds, whether they're in qualified retirement plans or not. If you have any of those assets and you're not 65 or on Medicare, those assets don't matter. It's only income driven when you're not 65. When you turn 65, now there's what they call an asset test in addition to an income test. So what I commonly find is somebody who's on Medicaid, got that zero premium, zero copays, a host of services. It's pretty attractive. Those are the people that are really happy with, what they call Obamacare from the ACA. And then they find out that, my income is $15,000 a year, I'm single. And they're not going to qualify most likely for Medicaid when they turn 65. So that, what I call the yellow brick road, goes away. And they're not eligible for those, what we call special needs plans. When you're on Medicare and Medicaid, if you're what they call dually eligible, full Medicaid, you are eligible for a dual eligible program, or have the zero premium, the zero copays, and a host of cool features. Now, I'm not saying you won't qualify for it when you turn 65. I'm just saying that the game changes. So, and look at this, a couple earning 15.4 when you're 65 would, or under, would qualify for Medicaid. So I went a little further on this. I know this stuff when I go into the Medicare website. This is the Medicare.gov website. There are levels here as well. They're not asking. They are asking, about assets as well. However, there are a few programs worthy of note, what they call Medicare savings programs, that I'm going to talk about just briefly here. The point of this video is really to say that, are you going to qualify for Medicaid when you turn 65? I don't know, but a questionnaire is coming, and some people are obviously going to qualify for it. Most of the people that I meet when this question or this situation comes up, I should say, they're not going to qualify for it. They're going to lose Medicaid. And while immediately turning 65, they still have Medicaid and they're going to get Medicare, and we can enroll them in one of those special needs plans. If they don't qualify for it, they will lose that. We will have to migrate them to a different plan, which may or may not have a premium, but it will certainly have copays and, responsibilities for doctors and hospitals and, MRIs or testing or lab work or what have you. So this comes up a lot. This is a market that I spend a lot of time in. And interestingly enough, there's a program right here called the Medicare Savings Program. There's 4 levels of it. They are all, asset tested or, resource based, except for one of them. And the one that is not, is it's called the qualified Medicaid. Is it this one? Excuse me. I apologize. I forgot which one it is. It is low income. Nope, that's not it either. They're all asking for resources. Apologize. Pretty sure it's the QI. This is a federal website. Yes. So here's your income threshold, $1,456 a month. What does this program do? It pays your Part B premiums for you. So the 146 or 145.60 a month in 2020 that they're taking out of your Social Security check or that you're paying by check, if you're not collecting Social Security, that money can be eliminated if you qualify. This is the income threshold, 1,456 single, 1960 married. And while it does list in a resource limit, this is the most money you can have, in the bank or in the stock market or IRAs or 401ks or outside of your home and car and basic necessities. This threshold does not apply in New York State. In every other state that I'm aware of, it does, but not in New York. This is an individual, by the way, resource limit. This is the married. So that's kind of cool. I run into a lot of people who qualify for this who have no idea. I mentioned in a previous video, I met a guy, I think he was making about $1,200 a month. He got a letter from Social Security stating that he was going to be deducted $144.60 a month for Medicare Part B. So he qualified for this. I helped him apply. It's a very easy application in New York State, sending it into the Department of Social Services. I'm certain he's going to get this. And that's going to give him another $144.60 a month to live on. I mean, that's a big number. It's almost 11 or 12% of his income. So just be aware that, that's one of the scenarios that he's going to fall into. While he doesn't qualify for full Medicaid, he's losing Medicaid. Sadly, I laugh because people aren't aware of this. Nobody's going to come out there and say, oh, did you know you don't have to pay this? I mean, clearly Social Security had sent him a letter. I saw the letter. I've seen it many times that says we are going to deduct Part B premiums from your Social Security check. And that's a real how do you do. I mean, here the guy is 64 years old paying no premiums, got no copays. He's turning 65 and they're telling him they're going to be taking this out of his check. And he doesn't know what's going on. And it gets, a little worse because now he's got to go into, a Medicare environment where unless he wants to pay a sizable premium, he's going to have copays at the doctor, at the hospital, for most services. And he's going to lose Medicaid. There's no doubt. This is really the focus of what I wanted to talk to you about. This is important for agents to let people know that they may qualify for something else. This is one of 4 levels of Medicare savings programs. I'm only talking about this one. As I said, the primary focus here is to say, will you qualify for Medicaid when you turn 65? Well, I don't know. But if you look at this chart, you'll determine whether or not you will. And when you get the questionnaire and you start filling that out, it's going to be very clear with the questions that they ask whether or not you're going to qualify. So, if you have a department in your county of the Office of the Aging, they can be really helpful, or some sort of a liaison and an elder community. Maybe there's one in your area here in the Hudson Valley, especially in Ulster County where I live near Woodstock. There's a great one in Kingston, the Office of the Aging. You can call the Department of Social Services and maybe they can help you. It's nice if if you're convinced, or if you know that you're going to qualify for it ahead of time. Just be educated, just be informed, to advocate for yourself, because we know how it is on the phone with somebody. You never know if they are an ally or some sort of a parasite that may not want to help you. I mean, it's just human nature. Or if your agent, if you've got a good agent, I fancy myself a good agent. If you're a good agent, you'll know these things. Now, I'm not an expert in that area. I'm a health insurance agent, so I send people, to liaisons, mostly the Office of the Aging, when there's something that's a little out of my realm. I'll help people apply for this Medicare savings program. I don't get so involved in the Medicaid applications because they're complicated. Sometimes it makes me feel like we're applying for, disability, which is not something that I know how to do. So, maybe you know something different or have some other information you'd like to comment here. Maybe this happened to you, or maybe you're curious, you've got some questions, you're welcome to comment on this. And I just wanted to, as I say, announce this and let you know that I understand how it works. This may be a tough spot, but there may be some strategies that you can utilize that you're unaware of, and finding the right person to help you could really be beneficial in your bottom line. So if you have other questions, as I said, you can ask me here, or you can go to my website, medicareprepare.com. Thanks. Have a good day.